Welcome to MI Radio's Myanmar Today. I'm Melody, and here are today's reports. State Counsellor presents plans for consequences and impacts of COVID-19. Total numbers of the confirmed cases pass 5,000 nationwide. All townships except Cocogyun of Yangon Region now under stay-at-home plan. Basic foodstuff market runs sluggish in resurgence of COVID-19. Before we get to the reports, let's take a look at the feature local news for today. Union Minister for International Cooperation of the Republic of the Union of Myanmar, U Jordan, held discussions with Maurice Payne, Minister for Foreign Affairs and Minister for Women of Australia, via video conference on Monday from the Ministry of Foreign Affairs in Naypyidaw. During the video conference, the ministers cordially exchanged views on further advancement of the existing bilateral relations and cooperation between Myanmar and Australia, including the holding of a high-level consultations on development cooperation between the two countries before the end of the year. Preparations for holding of the forthcoming Myanmar's general elections successfully in November, in line with the COVID-19 preventive health guidelines and sharing of Australia's experiences in holding elections during the COVID-19 pandemic. The Union Minister expressed thanks to Australia for its contribution of $1 million Australian dollars to the ASEAN COVID-19 Response Fund and Australia's support for Gavi COVID's Facility Advanced Market Commitment that will provide access to the Southeast Asian countries, including Myanmar, to have safe, effective, and affordable COVID-19 vaccines. The ministers also discussed matters related to the arrangements and facilitations of relief flights to repatriate their citizens stranded in Myanmar and Australia, and Australia's 2-year assistance program for Myanmar in health security and economic recovery to mitigate the socioeconomic impacts brought about by the COVID-19 pandemic. The Australian Foreign Minister expressed Australia's understanding of the complexity of challenges faced by Myanmar, including the Rakhine issue, and reaffirmed its willingness to provide constructive support and assistance to Myanmar's efforts in overcoming the challenges in its democratic transition. Although Tropical Storm No, which started occurring in South China Sea, has weakened into a land depression, the consequent gale and heavy rain and tidal waves killed 3 people and damaged more than 90 houses in Ye, Bao, and Jaito townships in Mon State. Mon State Chief Minister Dr. A. Zen, alongside officials of Disaster Management Department of the Ministry of Social Welfare Relief and Resettlement, visited Jaito Township to provide humanitarian assistance to the victims. Meanwhile, Disaster Management Department officials of the relevant states and regions, together with regional government officials and General Administration Department officials, have been visiting the sites and providing humanitarian assistance. Aya Bank stated in its press release following the coronavirus cases mounting in Yangon Region, Aya Bank has stopped its services in 43 branches in the region starting from Monday. Among a total of 121 branches of Aya Bank in the region, 78 branches will keep opening regularly. This move is aimed to reduce the operation service amid the COVID-19 crisis as Aya prioritizes the health of customers and the staff during the banking service. And I believe it's time now for our first report. State Counsellor Aung San Suu Kyi presented the latest situation of COVID-19 within the country, including how the government and the Ministry of Health and Sports are taking actions against COVID-19 spread, and they're also preparing for access to successful vaccine and long-term impacts in the future. The state councillor mentioned that 1,000 billion kyat was already defined as budget to remedy consequences and impacts of COVID-19.
In her capacity as the chairperson of National Level Central Committee on Prevention, Control and Treatment of COVID-19, State Councillor Aung San Suu Kyi delivered a televised speech on 21st of September expressing how the government and the Ministry of Health and Sports are currently responding to the consequences of COVID-19 spread and the future plans. The State Councillor said that the government is taking serious actions against COVID-19, including imposing strict regulations. The stay-at-home order was imposed on Yangon Region, excluding Cocogyun Township, to curb the spread of the virus.
အားလုံးပေါ့နော်ဒီနိုင်ငံမှာရှိတဲ့ပြည်သူတွေအားလုံးကတတ်နိုင်သမျှဝိုင်းဝန်းပြီးတော့အတူယုံပေးတာဟာဒါဟာကျွန်တော်တို့သိပြီးတော့ကျေးဇူးလက်တင်တယ်ကိုကျူဆိုလဲကျူဆိုပါတယ်အဲ့ဒီထက်မှရှေ့တန်းကတော့ကျွန်တော်တို့ရဲ့ကျန်းမာရေးဝန်ကြီးဌာနဝန်ထမ်းနေနဲ့နောက်ပြီးတော့ကျွန်တော်တို့ဒီ quarantine center တွေမှာကူညီနေတဲ့စေနာရှင်တွေဖြစ်ပါတယ်ဒီကြာလာတဲ့အခါကျတော့ဒီဝန်ထမ်းတွေလည်းပြင်ပပါတယ်ကျန်းမာရေးဝန်ကြီးဌာနဝန်ထမ်းတွေကြားထဲမှာယောဂဆွဲကထားတွေလည်းရှိလာတယ်ဆိုတာလည်းပြည်သူတွေသိပြီးသားဖြစ်မှာပါနောက်ပြီးတော့လည်းစေနာဝန်ထမ်းတွေလည်းပြင်ပလာကြပါတယ်ပြင်ပလာကြတဲ့အချိန်မှာပဲစောင့်ရှောက်ရတဲ့လူတွေကလည်းအများကြီးပို့ပြီးများလာပါတယ်အဲ့တော့ဒီလိုစောင့်ရှောက်ရတဲ့လူတွေအများကြီးများလာတဲ့အခါမှာတခါတလေလို့ရှိလို့ရှိရင်အားလုံးရဲ့စိတ်ကြိုက်ပေါ့နော်အားလုံးကျေနပ်အောင်လို့စောင့်ရှောက်မှုမပေးနိုင်တာဒါကတော့သိပြီးတော့ထူးတွေအော်တစရာအကြောင်းမရှိပါဘူးအဲ့ဒီဟာအတွက်ကျွန်တော်တို့ပြည်သူတွေတင်းကြီးခံစေချင်ပါတယ်တင်းကြီးခံမှာကိုရင်းစားပါ
First, she mentioned that all the citizens have to cooperate with the government and the Ministry of Health and Sports when struggling in fight against COVID-19. Medical workers and staff from the Ministry of Health and Sports are given the best service from the front line, and even some medical workers have got infected. The volunteers are also helping at the facility quarantine centers when more and more people are necessary to be under quarantine. The state councillor requested the public to be patient when the medical workers and the volunteers may have imperfectness and ask the public to help them back. A committee for technology support was formed with Dr. Zomye, former Minister for Health, as chairman. The government is to support the medical workers, volunteers by providing enough medical supplies and protective items. It is working to have enough hospitals and quarantine centers as well.
ဒီဘီလီယံတစ်ထောင်ကျော်ရွှေ့ပြောင်းလိုက်တယ်ဆိုတာဟာကျမတို့ကိုဗစ်ရောဂါနဲ့ပတ်သက်တဲ့အကျိုးဆက်တွေအတွက်ကိုဗစ်ရောဂါနဲ့ပတ်သက်တဲ့လိုအပ်ချက်တွေအတွက်သုံးဖို့ဖြစ်ပါတယ်ဒီလိုကျွန်မပြောပြတာပြည်သူလူထုတွေအတွက်ကျွန်တော်တို့တတ်နိုင်မြအားလုံးပြင်ဆင်ထားရတယ်ဆိုတော့သိစီခြင်းလို့ပါစိုးရိမ်မလွန်စေဖို့ဘယ်လိုပါမလွန်စေခြင်းလို့ပါ
Then the state councillor mentioned that 1,000 billion kyat were funded as the budget for responses to COVID-19.
ကျွန်တော်နိုင်ငံအနေနဲ့အမှန်ပြောရမယ်ဆိုလို့ရှိရင်ကာကွယ်ဆေးထုတ်လုပ်နိုင်တဲ့အခြေအနေနောက်ပြီးတော့ကုသဆေးထုတ်လုပ်နိုင်တဲ့အခြေအနေမရှိပေမဲ့ဒီလိုဆေးတွေပေါ်လာတာနဲ့အမျှအချိန်နဲ့တပြေးညီကျမတို့နိုင်ငံကိုမြန်နိုင်တော့မြန်ပေါ့နော်ရောက်နိုင်အောင်လို့ဆိုပြီးတော့ကျမတို့အခုတည်းကနေပြီးတော့စီစဉ်နေပါတယ်ဥပမာဆိုရင်အပြည်ပြည်ဆိုင်ရာပူးပေါင်းဆောင်ရွက်ရေးဝန်ကြီးဌာနနဲ့ကျန်းမာရေးဝန်ကြီးဌာနကနေပြီးတော့ဒီလိုဆေးတွေထုတ်နေတဲ့နိုင်ငံကတန်တမာနေနဲ့ချိတ်ဆက်ပြီးတော့ဘယ်လောက်ကျမတို့အနေနဲ့မြန်ရနိုင်ဖို့အလားလာရှိလေအကယ်၍ဒီဆေးတွေအောင်မြင်နေဆိုရင်ပေါ့နော်ဒါဆေးတွေကသုံးတယ်မသုံးတယ်ဆိုတာကမ္ဘာ့ကျန်းမာရေးဌာနကလည်းကြည့်ပြီးတော့စမ်းသပ်ပြီးမှဆုံးဖြတ်မှာဖြစ်ပါတယ်
When working for the containment of the virus at the present time, the government is also working for access to any successful vaccine against COVID-19. The state councillor explained that the government is negotiating and engaging with the relevant ambassadors from the countries where the COVID-19 vaccines are tested in order to receive any successful vaccines as quick as possible.
အခုချိန်မှာတော့ဒီအဓိကအဖြစ်ရန်ကုန်တိုင်းမှာCOVID ရောဂါပြန့်ပွားမှုကိုထိန်းချုပ်နိုင်မှုကိုကျမတို့အားလုံးအားစိုက်ရပါမယ်
As the government is taking note of long-term and necessary control measures, the state councillor urged the citizens to focus on the current spread of COVID-19, especially in Yangon Region. She said only the individual observance of the rules and regulations can end the severe spread of the virus in the nearest future.
That's the report on State Councillor present plans for consequences and impacts of COVID-19. COVID-19 positive cases have been climbing up since mid-August, reaching over 5,000 nationwide. Myanmar COVID-19 cases hit 1,000 on the 3rd of September, 2,000 on the 10th of September, and 3,000 on the 14th of September. Last Thursday, the cases reached over 4,000, and within 3 days, the cases passed over 5,000 as of the announcement made on Sunday morning.
With the surge of COVID-19 cases, Myanmar is inching towards 6,000 positive cases with nearly 100 deaths. Infections have increased to hundreds of new cases per day over the past weeks after the COVID-19 broke out once again in the western state of Rakhine, following the weeks without a confirmed domestic case. Yangon is the worst affected region, reported with over 3,000 cases since the 16th August, followed by Rakhine State with more than 900 cases. On the 20th September, a total of over 600 cases were detected and over 500 cases were from Yangon. Moon State and Mandalay region followed the third with over 100 cases. Professor Dr. Zoweso, Vice Chairman of Yangon COVID-19 Prevention, Control and Treatment Committee, spoke to MI Radio that the public following the rules by staying at home will be a huge help to the frontline workers as the surge of the cases are detected a lot these days. He said,
in giving medical treatment to the patients, we are trying to have enough health workers, including general physicians and some specialists and nurses. There were some health workers who were also infected from the patients too. As the infection can be longer than we expected, we have to try to be flexible with these restrictions. If the people are used to be familiar with this kind of new normal lifestyle, and if they have to try to prevent themselves, they will be able to fight back the infection. As the infection surge, Yangon, which is a commercial city, has become deserted as the people are afraid of the infections. So I want all the public to follow the rules and regulations from the Ministry of Health and Sports and should stay at home.
On 1st September, a total of 919 cases were already reported. On the 20th of September, the number of the confirmed cases in the Myanmar reached 5,541 cases. A total of over 4,600 cases were found out within 20 days. Before the 4th of September, there were only 6 deaths in the country. From the 4th of September, the death rates increased. On the 14th of September, 12 deaths were reported within a day. On the 17th of September, 20 deaths were reported within 24 hours. With 100 cases of the COVID-19 cases announced on the daily basis in Myanmar, the Ministry of Health and Sports instructed the whole of Yangon region, except Cocogyun Township, to stay at home after more than 4,000 cases were reported within the region in the past 36 days. The Ministry of Health and Sports is doubling its efforts in response to the fast-spreading virus, making the best use of its resources while giving priority to 3 strategic responses: contact tracing, treatment, and restriction. Umamau Region Lotto representative from Cocogyun Township spoke to MI Radio that they are trying their best to curb the infections in their township. He said,
the houses with positive cases detected are in lockdown. Many volunteers and other community organizations helped in each ward. Most other people follow the rules and regulations as they have seen the rapid infections and death rates. We're gonna expand some new quarantine centers in the township as there are so many infections in our township. So the people who have contacts with the positive cases have to stay at home and the rest of the health workers took the swab. If they are tested positive, they have to receive medical treatments at the respective hospitals.
Across the world, COVID-19 has claimed more than 965,000 lives in 215 countries. Over 31 million COVID-19 cases have been reported worldwide, with the recoveries exceeding 22 million, according to the figures from the Worldometer Coronavirus Resource Center. In Myanmar, there are a total of 6,471 cases, with 100 deaths and 1,445 recoveries, as of the data released from the Ministry of Health and Sports.
That's the report on total numbers of the confirmed cases past 5,000 nationwide. And now we move on to the third report. The Ministry of Health and Sports announced that to contain the spread of COVID-19 within the Yangon region, its townships, excluding Cocogyun Township, are imposed with the stay-at-home order. Governmental offices have adapted the rotate working system, while some businesses and companies are instructed to work from home. The CMP workplaces are to be closed for 2 weeks. The residents from the Yangon region are to follow the stay-at-home order.
On 20th of September, the Ministry of Health and Sports announced that all townships in Yangon region except Cocogyun Township are under a stay-at-home plan. Because of the increasing COVID-19 confirmed cases in Yangon, the ministry has extended the stay-at-home order, which was previously imposed on 28 townships. All the residents in Yangon region except Cocogyun Township are to follow the regulations exclusive of stay-at-home order, which came into effect on the 21st of September. The civil servants are to rotate on a 2-week for office attendance and 2-week on work-from-home basis. Except private sectors, including banks and financial services, fuel refilling stations, food businesses and cold warehouses, pharmaceutical and medical equipment businesses, drinking water businesses, and factories producing daily hygiene products. The remaining organizations and companies are to apply work-from-home system. Only 1 person per household can go outside to buy groceries, and only 2 persons per household can go outside for hospital or clinic visits. Permitted vehicles and these transporting workers can only go through the townships. Within the ward, only the driver and 1 other person are permitted to go shopping, and only the driver and 2 other persons to go to the hospital or clinic. Dr. Tanaiso, Director of Health Knowledge Promotion Division from the Ministry of Health and Sports, said.
Both in the markets and supermarkets, only food shops and pharmacies are allowed to open. Only permitted persons can go out, and limited number of people per household can still go outside for a necessary reason. This is different from lockdown, which does not allow going out from home at all. The basic principle is that if a person is infected and he is isolated, he will be the only one to suffer from the disease. According to the latest research, the duration of the virus infection from the infected person to other people lasts for 11 to 14 days. This is why we apply quarantine system and social distancing. The lesser number of contacts among the people, the lower the risk of the infection.
28 townships were already under stay-at-home plans in the early week of September, and the newly restricted townships are also undergoing preparedness. U Daimyin is regional representative from Damui constituency 2, and he talked about how they are doing preventative measures in Damui Township, which has already been under a stay-at-home plan since 9th of September.
In a township, under the guidance of township administrator, the ward administrators are conducting the COVID-19 prevention works in respective wards. Now, a new quarantine center has been kept opening and already received about 70 people. In each ward, the streets are now closed, but the buildings and houses where the positive patients are found are in lockdown. During this resurgence period, majority of people are aware and following the health regulations despite some still being careless. For us, when conducting COVID-19 preventive measures, we welcome stay-at-home plan. Now, all the townships in Yangon except Cocogyun are now under stay-at-home plan. This can help a lot in preventing and curbing the spread of the virus.
Moreover, it is stated in the announcement that CMB factories and workplaces are not allowed to have staff coming into the workplace for 2 weeks, from 24th of September to 7th of October. Dornin Damon is factory owner of Shui Sisa Garment Factory, and she said,
For 2 weeks suspension, we will request the buyers because we need to follow the regulations released by the government. At present, we have orders in hand until the end of October. This is not such challenge for our factory to suspend operation for 2 weeks. When we're operating, we make sure the workers wash hands, wear face mask, and face shield. We make sure we provide hand sanitizer every hour while they're walking, as well as disinfecting the workplaces twice in a day.
For those who are permitted to go out for work, grocery buying, purpose, or clinic visits, it is a must to wear face masks. If any of the residents from the restricted townships fail to follow the stay-at-home order, it is announced to take action in accordance with the existing law. In Myanmar, the total confirmed cases have already passed over 6,000 nationwide, with the most confirmed cases found within Yangon Region.
That's the report on all townships except Cocogyun of Yangon Region now under stay-at-home plan. Let's move on to the last report for today. With the resurgence of COVID-19, the market of basic foodstuff is seeing sales drop. September is usually a time of celebrations, including almsgiving ceremony and festivities. But this year, because of the ban on festivities as a preventative measure against COVID-19, the sellers are losing orders and customers.
There is not much change in the price of the essential basic foodstuffs for the public, but the business is significantly getting cold. In the last week of March, when the first cases of COVID-19 in Myanmar were confirmed, the sales were running too fast in the basic foodstuff market, and some retailer shops had to face with a shortage of the supplies. In the resurgence of COVID-19, the business is getting really colder unlike before. U Kin Han, chairman of Myanmar Onion, Garlic and Culinary Crops Production and Export Association said.
In
short, the markets are really cold and the business is not going well. In the past, we used to sell a lot in our brokerage centers every day. Now the trade is really not good. In fact, the impact of this COVID wave is quite severe, not only just for the owners, but also for the workers. The government is providing support which can help the workers a bit for their living. Normally, these months are really busy because of the upcoming donations. The ceremonies in October and the donations for the injured are held, and so the markets were very active last year. But for this year, we cannot say, and the things are unpredictable. It seems that the prices had gone up recently, but now they are not rising. That's why everything is difficult. Another thing is that the hotels, the restaurants, and the schools are not allowed to open. Even if schools are reopened, there will be no canteens anymore. We do not see any sudden improvement in this month too.
September is usually a time of celebrations, including almsgiving ceremony and festivities. This is the time when the market is normally alive with those placing pre-orders and the prices are slightly high. But this year, the sales are significantly cold due to the impact of COVID-19. In addition, the sellers are being aware of themselves not to be infected with the COVID-19. Unaiso is a seller from Bumiya Market from the Cocogyun North Township, and he said,
Currently, we are selling our goods despite worries about the virus risks. The sale is not so bad at all because we all need to buy and sell every day, regardless of the risks of the disease, and we have buyers here. We wear masks and gloves to protect ourselves from the virus while selling our goods, and we always stay apart with our customers. The sale rate has dropped compared to the past as only the few customers came. Rice, oil, eggs, fish paste, and the dried fishes are the main commodities that our customers had bought. Actually, we are all afraid of the COVID-19, but we continue to sell because we cannot live without selling. So we are selling with care amid the pandemic.
The consumers buy the foodstuff only when they are in need. Some bought what they want in advance in the outbreak of COVID-19, and they are now buying only minimal quantity of the basic foodstuffs. Dozan shopper from the Cocogyun North Township said.
ဈေးဝယ်နေတဲ့အချိန်တော့မဝယ်မနေမဖြစ်လို့လာပြီမဲ့ဒီကာလဆိုတော့စိုးရင်စိတ်နဲ့တော့
I came here because I must surely buy the commodities for my family, but I am worried, so I need to wear masks and gloves, and then I follow the social distancing rule issued by the Ministry of Health and Sports. I wait for my turn if there are many buyers in front of the shops. That's how we make buying. I always come to the market by protecting myself, although I am concerned about the virus. The only thing we faced as a difficulty is queuing to buy goods, as there are lots of customers and we need to stay apart. The prices are the same before and after. I don't come here every day, but I always buy enough commodities for about 2 days. I can buy more than the amount for 2 days as I need to consider my incomes and expenses. According to the current Central Statistics Office, consumer prices and inflation stood at 161.14 CPI in July of 2020, an increase of 1.7% compared to the same period of last year and up 0.1% from 160.98 in June of 2020. For the nationwide inflation rate, which was calculated based on the consumer prices in the 2012 basic year, is averagely 7.14% annually until July of 2020, and the year-on-year inflation rate was 1.7%, according to the Central Statistics Office.
That's the report on basic foodstuff market runs sluggish, a resurgence of COVID-19. Now to international news. All pubs, bars, restaurants, and other hospitality venues across the whole of England are forced to start closing at 10 p.m. from Thursday as UK Prime Minister Boris Johnson tackles a second wave of COVID-19 infections. Johnson, who will address both Parliament and the nation on Tuesday, will also say the hospitality sector will be restricted by law and to table service only. According to excerpts of his remarks provided by his Downing Street office on Monday, shares in Britain's listed pubs and restaurant groups fell sharply on Monday in anticipation of the move. While there is no consistent policy for the country, the move will advance the closing time by at least an hour for most areas. While a full lockdown remains a possibility, the PM is said to be very keen to avoid that. The top U.S. public health agency stirred confusion by posting and then taking down an apparent change in its position on how easily the coronavirus can spread from person to person on small droplets in the air. The CDC has said that the virus spreads primarily through small airborne droplets, like those that fly through the air when someone coughs or sneezes. Most CDC guidance about social distancing is built around that area, saying that 6 feet is a safe buffer between people who are not wearing masks. In interviews, CDC officials have also acknowledged growing evidence that the virus can sometimes spread or even smaller aerosolized particles or droplets that spread over a wider area. That's one reason public health experts urge people to wear a mask, which can stop or reduce contact with both larger droplets and aerosolized particles. On Monday, federal health officials said the post was a mistake and that it had been released before full editing and clearance was completed. They said the CDC plans to clarify the agency's thinking, but the agency did not immediately release a statement or revision. In a statement released on Monday, the agency said the revisions to the How COVID-19 Spreads page happened, quote, without appropriate in-house technical review. End quote. The statement said, quote, we are reviewing our process and tightening criteria for review of all guidance and updates before they are posted to the CDC website, end quote. The United States President Donald Trump raced on Monday to cement a conservative majority on the U.S. Supreme Court before the November 3rd election, telling the media he planned by Saturday to reveal his pick to succeed liberal icon Ruth Bader Ginsburg. U.S. Democrats' hope of keeping the seat empty faded when two Republican senators, Chuck Grassley and Cory Gardner, signaled their support for moving forward quickly. Speaking to reporters at the White House, Trump said he was zeroing in on 1 or 2 candidates among 5 who are under consideration. He called on the Senate, controlled by Republicans, to vote on the confirmation before the election, in which he is seeking a second term. Trump said he is considering 5 women for his nomination for the U.S. Supreme Court seat. That's all with the news and reports on Myanmar Today. Hope everyone is staying safe.